Hello, I'm Neeraj Sood. I'm a professor of public policy at the University of Southern California, and I also have appointments in the School of Public Policy, in the Business School, and the School of Medicine. So, India has made huge strides in terms of providing health insurance for its citizens in the last 2 decades. So, about 2 decades ago, there was hardly any health insurance available to citizens. It first started with states taking leadership and providing state sponsored social insurance programs, mainly targeting poor families. And now, more recently, the Prime Minister's uh, insurance program, the Ayushman Bharat, that is going to be the largest health insurance, government sponsored health insurance program in the world. So I think we've made tremendous strides in terms of providing some basic health insurance coverage. The challenge is that insurance coverage only covers secondary and tertiary care. So it basically covers, major care in a hospital. It doesn't cover a very important part of care, which is primary care. And that is the challenge the government or India needs to meet, that not only provide insurance for secondary and tertiary care, but also cover primary care. So one of the challenges is that we need to improve access to primary care, especially in rural areas. So some of my research shows that if we are successful with that, there is a huge return on our money. So we did an analysis where we estimated how many lives would be saved, or how many disability adjusted life years would be saved if we only provided primary care for cardiac conditions. And that number for India was 3.6 million disability adjusted life years. So a huge amount of health benefit for a small investment. So this is really cost effective, and we need to figure out how to do it. The one big challenge is that there is chronic absenteeism, at least among the government healthcare system, that physicians don't want to locate in villages. They do not want to practice in villages. And a lot of the people in villages then end up relying on care in the private sector, which can often be of poor quality. So one way to solve this problem would be increased reliance on telehealth. So you can tell your primary healthcare physician, you don't need to relocate to the village, or you need to only show up at the village once in a month or twice in a month. Rest of the time, you can still provide care to people in the village by being in a city, and having a telehealth system where villagers can consult with the doctor, or the asha worker can assist the villagers in consult. Like if the villagers don't have access to a smartphone or a tablet, the asha worker can help connect the villagers to the physicians in the cities. The other thing we have to do is, we cannot rely on just the goodwill of physicians. We have to give them incentives to show up in the villages, right? So we need to create a system that, if you, for example, in the US, if you practice in a rural area, they forgive your loan for going to medical school. So we need to come up with similar incentives, that if you practice in a village, then we will forgive some part of the money you invested in your medical education. Or if you got subsidized education in a government medical school, part of the deal is you have to spend at least 1 year in a village. The other thing is uplifting the citizens of the village, that if I grew up in a village, I am more likely to go and practice in the village. So making sure that people in villages have access to high quality medical education, so that some of the villagers can become doctors themselves and then go back and serve their community. So I think we need to kind of create these incentives, and at the same time rely on telehealth to fill the gaps for primary care in villages. So, we've expanded access to health insurance to a large fraction of our population. We are trying to increase access to care. But all of this is an empty promise if we do not focus on quality of care, right? So you can provide a physician to a patient, but that thing is no good until and unless the physician is providing high quality care to the patient, right? Which means the physician is doing the right diagnosis, the physician is providing the right treatment. We did this large study in collaboration with the National Academy of Sciences, where we showed that poor quality care kills 6 to 9 million people every year. That's actually bigger than the death toll of the pandemic, and that is happening every year. So this shows the enormity of the problem. The productivity loss from low quality care is $1.5 trillion. So that's a huge number. So why are we stuck in the system? Why are we stuck with low quality care? One of the problems is I, as a patient, cannot distinguish between a high quality doctor and a poor quality doctor. And if I cannot do that, then both the high quality doctor and the poor quality doctor can exist in the market. And doctors then don't have the incentive to invest in becoming a high quality doctor. So, one way to solve this problem is for the government to come in, assess the quality of doctors, and make that information publicly available. That will create two important pathways of improving quality. One is you're empowering patients. So a patient would now know I need to go to a 5-star doctor, not a 2-star doctor. The second is no doctor wants to be a 2-star doctor. So if they actually know that they are 2-star and that's available publicly, they will put in their own work, invest in improving their quality of care, and want to become a 5-star doctor. So I think public reporting of quality can kind of solve this market failure where patients don't know who's high quality and low quality, and really change the way physicians think about quality, change the way patients make decisions about quality care. So one of the challenges with the state programs are that there are just too many, a plethora of programs, and they have different eligibility criteria. So some might be for farmers, some might be for women, some might be for a cooperative society. And as a consumer, as a person, it becomes impossible to figure out how to navigate the system. And sometimes even small hurdles like filling out one form can make the difference between the person having insurance versus the person not having insurance. So a big kind of lesson from this is that we have to make it simpler and easier for the end consumer. That ideally people should be automatically enrolled in insurance as long as they have their Aadhaar card or BPL card. You don't need to make people fill out 5 forms, 10 forms to enroll in insurance. Because if you do that, even though it seems simple to you from a government perspective that all I'm asking them is to fill out 2 forms, it will take them 10 minutes and they will get a big benefit. Why can't they do that? The challenge is the research shows that a lot of people struggle to do that. They might not have the educational ability, or it's just a psychological barrier that people don't like to fill out these forms. So we really need to simplify the process for the end consumer. That is as important as providing the benefits, to make it easier for people to actually access those benefits.